Hi, Mr. Ensign. Can I come in?
Yep.
Hi, my name's Kelsey. I'm going to be your provider today. Nice to meet you.
Speed too.
Can you verify your name and date of birth for me, please?
Yeah, Brett Einstein, 4/22/96.
Okay, what brings you in today, Brett?
I have lower stomach pain.
Okay, when did the stomach pain start?
About 2 or 3 days ago.
Okay, where would you say, I know you said it's lower stomach, if you had to point to the area specifically, is there one area more than the other?
Just below my belly button, right and left.
On both sides,
yeah.
Okay. And is this pain constant? Does it come and go?
I'd say, yeah, it comes and goes, maybe about once every hour or so.
Okay. Characteristics of the abdominal pain. Is it like a sharp pain, an achy pain? How would you describe it?
I'd say sharp pain.
Sharp pain when it comes on?
Yeah.
Okay. And is there anything that you do that makes the pain worse?
No, usually just when I'm laying down, I'd say laying flat.
Okay, pain is worse when you're laying flat, but it's still just in the lower stomach?
Yeah.
Anything that makes the pain better?
Yeah, if I'm sitting upright in a chair or anything like that.
Okay, so positional. How about radiation? So I know the pain is in your lower stomach. Does it radiate anywhere else in your stomach or your back? Anywhere?
No.
Okay. Timing. So do you notice over the past couple days the pain's been worse in the morning or at night or better at any time?
It's worse in the morning and it progressively gets better throughout the day. And then usually at night I'm alright, and then that's about it.
Okay. If you had to rate the pain when it's at its worst from 0 to 10, 0 being none, 10 being the worst, what would you rate it?
Probably about a 5.
Okay. And are you having any other stomach or GI issues? Any nausea, vomiting, excessive bloating, anything like that?
No, just the stomach.
Okay. And do you feel like you have any idea of what you think might be going on?
No, I don't.
Okay. So I just have to go through a bunch of history questions with you. So we'll just go through all those and then we'll start your assessment. So past medical history, have you had any hospitalizations, major surgeries, or even any major illnesses?
No, I haven't.
Okay. Have you ever been diagnosed with any major chronic conditions? So heart failure, diabetes, COPD, cancer, any alcohol abuse?
No, I haven't.
Okay. How about your family? So those major conditions that I just talked about, how about immediate family, like your parents, your siblings, or your grandparents? Have they ever had any of those?
Yes, my grandpa has COPD and my father has heart failure.
Okay. Are they both still living?
My grandpa just passed away, but my dad is still alive.
Okay. Sorry to hear about your grandpa.
Thank you.
What do you do for a living?
I am a operator at a treatment plant.
Okay. Do you feel like you have any exposure at work to anything?
No.
Okay. How about home life? Are you married?
I am.
Okay. Any children?
No kids.
Okay. Do you live in an apartment in your own home?
We have our own house.
Okay. Just you and your wife live there?
Yeah, yes.
Okay. And how about any stressors, major life stressors right now? Anything?
No.
Okay.
Nothing.
And do you feel like you have a good support system at home?
I do.
Okay, great. So we're gonna go just into a little bit more history. Are you sexually active?
I am.
Okay. How many partners?
Just one.
Okay. Do you use protection?
We do.
Okay. And have you ever been tested for any STDs or STIs?
I have not.
Okay. And how about your sexual identity or your gender identity? Do you identify as male or female? Or?
I am male.
Okay. Okay. And we're going to just move on to your current history. So do you have any known allergies?
I'm allergic to the penicillins.
Okay. Any other drug allergies that you know of?
No, not that I know of.
How about food allergies?
None that I know of.
Any environmental allergies?
Nope.
Okay. Do you take any home medications?
No, I don't.
Any over-the-counter meds or supplements, vitamins, herbal supplements?
Vitamin C and multivitamins.
Okay, and that's all?
Yep.
Okay, great. How about any tobacco use? Do you smoke? Do you vape?
Nope.
Any illicit drug use? Cocaine, marijuana?
Nope.
How about alcohol? Do you drink alcohol?
Occasionally.
Okay.
A couple a week.
A couple beers or mixed drinks or?
I'd say beers.
Okay,
Yeah.
and you said only 2 a week?
Yeah, 2 or 3. Yeah,
Okay.
Maybe a week.
Okay. Tell me about your diet that you follow.
We have a very balanced diet.
Okay.
I'd say with fruits and vegetables and stuff like that.
Okay, great. How about caffeine? Do you drink caffeine?
I do.
Do you drink coffee, pop? What do you normally?
I probably have about 1 or 2 pops a day.
Okay,
I'd
no
say.
coffee.
No coffee.
Okay. How about vaccinations? Are you up to date on all your vaccinations?
I am.
Have you gotten your flu shot this year?
I have.
How about COVID vaccine?
I have not because I've not been offered it yet.
Okay, that makes sense. How about your exercise routine? Do you exercise regularly?
Besides at work, me and my wife, we go on walks. I'd say about 4 or 5 nights a week.
Okay, great. How about your sleeping habits? How many hours of sleep do you get a night on average?
I'd say anywhere from like 6 to 9.
Okay, and do you feel well rested in the morning?
I do.
Great. Okay, so we got most of the main questions out of the way. We're going to just go over a quick review of your systems, and then we'll get into the assessment portion.
Okay.
So, generalized, have you been having any like body aches, fever, chills, anything like that?
Oh, no, I haven't.
Okay. Skin, have you noticed any changes in your skin? Any rashes, swelling, itching, anything like that?
No.
Okay. So your head, any headaches, dizziness, anything like that?
Nope, none.
Ears and eyes, any changes in vision or hearing, any swelling, drainage?
No.
Nose, any nosebleeds, any swelling, difficulty breathing?
Nope.
And throat, have you had any swelling or pain or redness, any changes in your throat that you've noticed?
No.
Okay. So chest-wise, like your breast area, have you noticed any increased swelling, any lumps, any pain or discharge or anything from your breasts?
No, I haven't.
Okay. Abdominal. So I know you're having the lower abdominal pain right now. Have you noticed any changes in like your bowel habits, any pain anywhere else, any indigestion, anything like that?
Nope.
Okay. How about your breathing? So do you feel short of breath ever, or have you been having a cough?
No.
Okay. Your cardiac, so your heart, any feelings like your heart is racing like really fast, or that it's skipping a beat, any chest pain? You said no swelling that you've noticed.
Yeah, no, everything, all seems normal.
Okay. And then your stomach, you said just the lower stomach's been bothering you. How about your urinary system? So have you had any issues going to the bathroom, like peeing, any frequency or urgency, burning on urination, any blood or anything in your urine?
No, I haven't.
Okay. Musculoskeletal, so have you noticed any aches or pains in your joints, muscles, any issues bending, twisting, lifting?
No.
Okay. How about your endocrine system? So have you noticed any issues like regulating your temperature, or any weight gain or loss, any excessive like being hot or cold?
No, none of that.
Okay. How about your psychiatric history? So do you have any history of anxiety, depression, any feelings of wanting to harm yourself or others?
Nope.
Okay. Neurological. Do you feel like you have any like lapses in memory, or like I said, dizziness, any neuropathy, numbness, tingling in your extremities?
Nope.
Okay. Do you feel like you have any excessive bruising, like you bruise really easily, or like if you get a cut, it won't stop bleeding?
No. Nope.
Okay. So sounds like all of your systems, you're a pretty healthy guy. It doesn't really look like you have much of a major health history.
Mm-hmm.
So we can move on to the main assessment portion of it. So we're going to kind of go through your whole body systems. We're going to do your lungs and pulmonary system first.
Okay.
Then we'll move on to your heart and your abdomen, and then we'll finish up with your peripheral vascular, so your arms and your legs. Okay?
Yep.
So first for your lungs, we're just going to take a look at your thorax. So if you don't mind, I'll ask you to remove your shirt.
Okay. Do I need to lay down or anything?
Nope, I'll just have you stay sitting just like you are, but I'll just need you to remove your shirt. So I'm first just going to start looking at your thorax for any deformities or anything obviously that's wrong with it. It's okay, you're fine. So it looks like obviously you're breathing easily. I don't see any use of accessory muscles or any retractions in between your ribs. Those are just signs that you would be like struggling to breathe.
Mm-hmm.
And I don't see any noticeable scars or bulges at all. I'm just going to take a look at your back too. That all looks nice and healthy. So it all looks symmetric, which is what we're looking for. And I'm also looking at your diameter. So normally we want your front, anterior, and posterior, so your front and back diameter, to be wider than your side diameter.
Mm-hmm.
With certain diseases, pulmonary diseases, it can cause like a barrel chest. where that diameter and ratio would be off. So your anterior and posterior compared to your lateral over here looks about 2 to 1, which is appropriate and what we're looking for. And your respiratory movements all look symmetrical, which is great.
Okay.
So I'm just going to do a quick palpation of your thorax area. Are you having any tenderness or pain at all in any of those areas?
Nope.
Okay, so if you were, I'd focus on those areas. I don't see any bruises or lesions. If I did, I would focus more on that as well. So I'm just going to do like a light palpation over this area and just let me know if there's any tenderness at all. Is that okay?
Yep.
Okay. How's that?
Everything
Okay.
feels good, yep.
Okay, so I'm going to have you actually turn towards the wall.
Okay.
And I'm just going to check your chest expansion. So I'm going to place my hands down here on your coastal margins, and what I'm going to have you do is just take a deep breath in and out. Oh, go ahead and turn back towards the wall for me. Okay, and go ahead and just take a deep breath in and out. Good, and relax. One more. Great. Great. So I'm just testing your chest expansion with my hands, and everything looks nice and symmetrical.
Okay.
So now what I'm going to do is I'm going to test your tactile phragmitus. So I'm just going to place the ball of my hands on certain areas of your chest.
Okay.
When I move my hands, I'm going to just have you say the words 99. So I'm just feeling for the vibrations and making sure they're even in your chest.
Okay.
I'm going to start up here.
99.
Good.
99.
Good.
99.
Good. And do you want to turn back around for me? Thank you. I'm going to have you cross your arms in front of you. Good. And then repeat that again.
99. 99. 99. 99.
Great. And you can stay sitting like that just for a minute.
Okay.
So I'm going to start by percussing. So I'm going to just do your back first since we're right here, and then we'll go to your front, okay? So I'm going to percuss in a ladder-like portion using my middle finger here, and you're just going to feel me kind of striking against it, okay?
Okay.
I'm just listening for even sounds. Good. So all areas sound resonant, and there's normal sounds, no dullness in any areas noted, which is great. While you're back here, I'm going to just check for your diaphragmatic excursion.
Okay.
So I'm going to just percuss a little bit more. What I'm going to have you do first is just take a deep breath in, and then when you exhale, in and out, and then just kind of hold it after you breathe out, and don't breathe back in, okay?
Okay.
Good, and just hold it there. Okay, right at that mole. So now next, what I'm going to have you do is just take a deep breath in when you're ready and hold it in, okay? Okay, you can let it go. So I'm just measuring how your diaphragm moves with those deep breaths. Normal is from 3 to 5 centimeters, and this is about 4 centimeters, which is great and within normal limits. So I'm going to have you actually turn back around, and I'm going to percuss the front, okay?
Yep.
So I'm just going to start up here, and we're going to do the same thing, okay?
Yep.
So all areas up here sound resonant as well. There's no areas of dullness, so that's great, and that's what we're looking for. So now I'm just going to take a listen to all those areas again. So while I'm listening, I'm just listening for like the pitch and intensity of your breath sounds, as well as the duration, looking for any crackles, wheezing, any abnormal sounds.
Okay.
So I'm just going to start up here. We're going to do the same thing. So at each area, I'm just going to ask you to take a nice deep breath, okay?
All right.
Perfect. Great. No adventitious sounds, lung sounds were even bilaterally and clear, which is exactly what we're looking for.
Okay.
I'm going to have you spin around one more time for me towards the wall. And we're going to do the same thing here. Yep, deep breaths at every spot. Perfect. Great. The lung sounds there all sound bilaterally even as well. No dullness, no adventitious sounds at all.
Okay.
So the next thing that we're going to do is your cardiac exam. So for this exam, I kind of want you laying at like a 30-degree angle. So we can use a couple of these. Oh, that might actually work well, yeah. If you want to lean back just like that, that'll be great. Just move my stuff a little bit. I'm just going to wash my hands again. So we want you at about 30 degrees, so that looks pretty well. And at first I'm just going to kind of take a look at your general appearance. So again, you appear healthy. I don't see any like neck vein distension or any obvious abnormal cardiac issues. I don't see any major swelling. You appear healthy. No issues there. So I'm going to just inspect your jugular venous pressure and your carotid pulsations. So what I'm going to have you do is just kind of tilt your head to the left a little bit there. And I can see the pulsation and jugular venous pressure. You can kind of assess that. There's no deformities, abnormal pulsations, any bulging or anything like that.
Okay.
So I'm just going to peek at the other side here. I'm going to have you tilt your head a little bit this way. Good. No abnormal findings there either. So next I'm going to just kind of inspect your point of PMI, point of maximal impulse we call it. So that's kind of right over here. It might be better if I kind of come over here. So just inspecting, we don't see any obvious bulge, pulsation, anything like that, which we don't expect to find just looking. Thank you. So that looks good. So we're going to kind of move on. Sorry, I know it's kind of a weird spot. So I'm going to start by just palpating your carotid.
Okay.
So I'm just going to do it one side at a time here. Feeling for any abnormal thrills or. So there's no abnormal pulsations. They're +2 and appropriate pulses with an expected upstroke, no abnormalities. So I'm going to palpate your point of maximal impulse that I was talking about now. So that's at the 5th intercostal space midclavicular line. So the amplitude on that is brisk and non-sustained duration, which is what we are expecting. So now I'm going to palpate the pulmonic area. So that's on your left side here, and it's in the 2nd intercostal space. I'm just palpating for that impulse. Now we're going to do the aortic, which is the right 2nd costal interspace. And this is the aortic pulsations as well. Great. So now I'm going to take a listen. So I'm going to start by just listening to your carotid arteries. I'm just listening for any bruits, That would just be like an abnormal blood flow in there. So I'm just going to listen to that. So I'm going to have you just hold your breath for a minute.
Okay.
Good. Go ahead and breathe out. And take a deep breath in and hold it. Good. Go ahead and breathe out. No bruise present, so it's an appropriate sound is just what we're looking for.
Okay.
So now I'm going to listen to your heart sound. So if you don't mind, I'll have you can spin back around here. So I'm going to start by listening with the diaphragm, and then I'm going to flip it over and listen with the bell.
Okay.
So you can just breathe normally, and I'm just going to kind of go through the sequence here. So we're going to do aortic, pulmonic, Erb's point, tricuspid, and then your mitral valve. So I'm going to listen with the diaphragm and then flip it over and listen with the bell, okay?
Okay.
Great. I'm going to flip it over now. So listening with the bell just helps hear it's better tool to listen to any abnormal heart sounds. I hear normal S1, S2 heart sounds, which is what we're expecting. No abnormal heart sounds heard with either the diaphragm or the bell. If there were suspicions of a murmur, we would kind of have you position into your left lateral side. So I'm going to have you do that just to demonstrate how we would listen.
Okay.
So if you want to, you can just lay down and face towards the wall on your side. And I'm just going to place my stethoscope on his mitral area, and it'll just bring his heart closer to the chest wall to have a better listen. Good. So again, no adventitious sounds heard. If I did hear any adventitious sounds or any extra heart sounds, I would notice like the timing, frequency, and intensity, and where in the cardiac cycle I did hear those. So now we're going to move on to your abdominal assessment.
Okay.
So I'm just going to wash my hands again. So I'm going to have you lay down flat. If you don't mind, we'll kind of do like this, and then you can just lay with your feet down on your back.
Okay.
So the first thing I'm going to do is just inspect his abdomen. Upon inspection, abdomen is symmetrical, flat. There's no protuberant masses, no visible striae or scars, no abnormal rashes, lesions. Everything looks symmetrical. Hair growth is symmetrical and expected. There's no abnormal pigmentation or vasculature noted. I don't see any pulsation. Sometimes in very thin patients, you can see the aorta pulsation in the abdomen. I do not see that, but that's completely fine. So there's no bulges. I also don't see any obvious signs of peristalsis. So next I'm going to listen before I palpate. So I'm going to listen in all four quadrants. Then I'm going to listen over some arteries here. So I'm going to start by listening in the left lower. Your bowel sounds are all normal active, so they're gurgling and clicking appropriately, not completely constantly, but every couple seconds or so. So that's exactly what we're expecting. It just shows that your bowels are moving in the way that they're supposed to.
Okay.
So now I'm going to start by listening to some arteries on your stomach. So we have your aortic, your renal, iliac, and then also femoral. Good. So there's no bruits or abnormal sounds with those at all either. So I'm now going to start percussion. So I'm going to percuss the abdomen generally, listening for the tympani or any signs of dullness. Sometimes there are expected dullness if there's stool in areas, and also over organs. So we're going to kind of go on to that here.
Okay.
I'll go over here. So I'm just going to start by percussing all 4 quadrants. Just let me know if there's any tenderness or anything like that when I'm doing this, okay? Good. All areas sound resonant to panic. There's no dullness noted, which is great.
Okay.
Next thing I'm going to do is I'm going to percuss your liver span here. So first what I'm going to do is I'm going to do it your mid-clavicular line, and I'm going to palpate down from right here down until I hear the dullness and resonant sounds to hear where your liver border ends.
Okay.
I'm just going to start up here. Good. Now I'm going to do your mid-sternal border here. Good. So the liver span is appropriate. I believe it's 3 to 7 centimeters, and that's appropriate within that range.
Okay.
I'm gonna just percuss for some splenomegaly as well. So what I'm gonna do in this is I'm just gonna have you bend your arm up like this. I'm gonna go to your mid-axillary line down here, and I'm just gonna percuss down below the lowest inner space, and I'm gonna have you take a deep breath in, okay? Take a deep breath in. And there's no signs of splenomegaly, so that's great. So palpation, what I'm going to have you do is if you don't mind just scooching up, your head can be kind of up, all the way up, and I'm going to have you bend your knees up. So I'm going to start just by doing light palpation. Again, this will just be very light, but if there's any tenderness noted, just let me know, okay?
Right.
Does that feel okay?
Yep.
Okay, now we're going to go on to some deep palpation. So this is going to be a couple inches, but just let me know.
All right.
Any tenderness with any of that?
Nope.
Great. So I'm going to check for rebound tenderness. So what I'm going to do is I'm going to push down and then release quickly, and just like that. So just let me know.
All right.
Any pain at all.
Nothing.
Nothing? Great.
No.
So if there were any masses, I didn't feel any masses. Everything felt symmetrical. If there were any masses, I would describe them with like shape, consistency, if they could move, if they were painful, size, everything like that.
Okay.
No masses found. Everything felt fine to me.
Okay.
So we're going to move on. And I'm going to palpate your liver edge. So I'm actually going to come around this side. I'm going to place my left hand under here. Then my right hand up here. And then I'm going to have you take a deep breath. And one more time. Good. So liver edge is palpable. It doesn't seem like it's displaced downward at all, which is great.
Okay.
I'm going to reach over you and try to feel your spleen as well, okay? Take a deep breath for me. Go ahead and relax. So the spleen is not palpable. That's an expected finding. Sometimes we can feel the edge, but with you it's not palpable, but that's also completely normal.
Okay.
So I'm just gonna palpate your aortic width, so you can just stay put. It's just right left of the midline here. So I'm gonna palpate, feel it right here. So I'm gonna kind of trap it between my fingers here. And that is expected. Like I said, there doesn't seem to be any abnormal width or any issues with that.
Okay.
So I'm going to do a couple special tests here. These would just be tests that we would use if we suspected something specific. So the first one that we are going to do is I'm going to have you sit up and face the wall again. So this is just checking for any kidney tenderness, pretty much right around your costovertebral angles, which are right here.
Okay.
So what I'm going to do is just place my hand and I'm going to strike it, and I want you to let me know if there's any tenderness, okay?
All right. Nope. Nope.
Okay. So I'm going to have you lay back down if you don't mind. And I'm actually going to have you place your hand right like this. Right like, straighten it right down the middle. Okay. That's good. So I'm going to hit on one side of your stomach, and I'm going to feel for the fluid wave on the other. And this is just testing for ascites, okay?
Yep.
Good. So I don't feel any fluid waves, so there's no signs of ascites noted. So you can stay put just like you are.
Okay.
So I'm going to do a couple more tests. So the Ross-Fig test, this is just any right-sided pain during left-sided palpation. So when I palpate on your left side, just let me know if you're experiencing any pain anywhere, but especially on your right side, okay?
Okay.
Any pain?
Nope.
Great. So the next test that we're going to perform is the SOS sign. So this is resisted hip flexion. So what I'm going to have you do, I'm going to have you straighten this leg out and don't let me push it down, okay? So go ahead and like push up towards me and don't let me push it down. Any abdominal pain?
No.
Great. Let me do this side. Any abdominal pain there?
Nope.
Okay. So the next test I'm going to do, I'm going to take this right leg and I'm going to bend it and I'm going to rotate it inward. Any pain?
Nope.
I'll do this side as well. Any pain there?
No.
Okay, great. So that was the obturator sign. And then the last sign we're going to test is the Murphy sign. So what we're going to do for this one is I'm going to palpate your right upper quadrant here and ask you to take a deep breath when I'm palpating and just let me know if you have any pain, okay? Okay, take a deep breath. Any pain at all with that?
Nope.
Okay, one more. No pain at all?
Nope.
Great. Okay, and I'm going to have you sit back up and lean towards me. So the last system that we're going to go through is the peripheral vascular system.
Okay.
So I'm just going to wash my hands again here. So just taking a look at your skin general, your color is appropriate. I see no signs of cyanosis. No hypopigmentation, no lesions, rashes, scars. You said you don't really have any issues skin-wise that you notice?
Yep, nope.
Okay. There's no swelling that I know. Your ethnicity is, your skin color is appropriate for ethnicity and your age. It's pink and moist. Your venous patterns, they all look appropriate. There's no protruding veins or any vascularities in your lower extremities or upper. So I'm just going to kind of palpate your skin, look at your cap refill and feel some pulses, okay?
Okay.
Your hair distribution as well on your lower legs is all even. There's no patching or anything like that, as well as the rest of your body. So I'm just gonna start over here and look at this arm. Go ahead and flip for me. I'm gonna feel your radial pulse, your brachial pulse, great. Those are both +2, strong and expected, no bounding. And I'm gonna check your cap refill here. Cap refill is brisk and intact. And I'm also going to look at your epitrochlear nodes. I'm going to flex your elbow here and just feel for those epitrochlear nodes. Good. I'm going to come over to this side. Again, skin looks completely intact, appropriate. Feel radial pulse. +2, brachial pulse, +2. We're going to check the cap refill here as well. Both extremities are warm and pink, and the temperature is even on both. So I'm going to go down to your legs here. Same thing, like I said, hair distribution is even. I see no signs of any varicose veins, no protruding bones or muscles, tendons. So I'm gonna feel your popliteal here. Your posterior tibial. And the dorsalis pedis. Yeah, and if you want to, you can lean back against here and I'll finish the rest right there. So again, posterior tibial, dorsalis pedis, popliteal, and I'm going to check your femoral, okay, so you can lean back. Good. Those are all +2 and expected, and I'm going to check your cap refill down here. Good. We're going to just do the same thing up here. Feel the pulses first. Femoral. Popliteal. Posterior tibial. And dorsalis pedis. I'm going to feel your cap refill on these ones. Cap refill in both your hands and feet is brisk, less than 3 seconds, which is exactly what we're looking for. It's just showing that your blood flow is getting to the areas it needs to.
Okay.
There is absolutely no swelling in any of your extremities or your hands or feet. Again, your temperature is even throughout, no vascularities, no protrudent bones or anything like that. So everything looks great there. So I'm just going to go talk to my collaborating team about the abdominal pain and we'll kind of get a better plan and then we'll go from there. Do you have any questions for me?
No.
Okay, it was nice meeting you.
Nice
Take
meeting you
care.
too.